Welcome to The Explainer. I'm so thrilled to have you here today because we're doing a complete clinical overview of a really fascinating piece of medical technology, the Ambu SureSight Mobile Video Laryngoscope. Now, if you work in emergency medicine or EMS, you already know that securing an airway is, well, it's pretty much one of the most critical, high-stakes procedures you do, right? So today, we're going to break down exactly how this specific handheld device is engineered, top to bottom, to handle exactly that kind of pressure. Let's dive right in.
But before we get into the nuts and bolts, I want you to ask yourself a question. Think about your current airway kit for a second. Are you fully confident in your tools during those unplanned, high-stakes, pre-hospital intubations? We all know that emergency field medicine doesn't exactly happen in a brightly lit, perfectly controlled operating room. It happens in cramped spaces, right? Under unpredictable demands and with severe spatial constraints. Do your current tools actually meet that reality? Keep that in the back of your mind as we go through the data today.
Here's a quick look at our agenda for today. 1. Pre-hospital airway management. 2. Meet SureSight Mobile. 3. Built for the field. 4. The blade portfolio. And finally, 5. Tech specs and reliability.
Starting off with Section 1, Pre-hospital airway management, the unpredictable environment.
You know, the harsh reality of emergent and unplanned intubations is that you're so often facing terrible lighting, incredibly limited physical space, and terrain that is entirely out of your control. In these highly dynamic environments, you don't just need a standard laryngoscope. You really need a solution that offers supreme flexibility. You want a device with a small physical footprint that absolutely doesn't sacrifice high-quality imaging, because at the end of the day, securing that airway safely and swiftly is literally the only thing that matters.
Moving to Section 2, meet SureSight Mobile, the go-to video laryngoscope solution.
So, the SureSight Mobile is a handheld video laryngoscope crafted specifically for emergency medicine professionals. Just look at that ergonomic design and the familiar, really simple touchscreen experience. The reason this matters immensely, actually, it's all about cognitive load. In those unexpected emergent cases, task complexity needs to be as absolutely low as possible. This intuitive design significantly shortens the learning curve. That means you aren't out there fighting with your equipment when every single second counts for patient safety.
And that simple interface builds directly into a totally seamless documentation workflow. It's really just 2 steps. Step 1, you can capture images and videos with the simple push of a button to document the intubation. Step 2, you verify your intubation instantly. The device actually has this super simple playback feature that lets you review the recording of the intubation right there on the screen, immediately. You don't need to waste time transferring files to another device first. It's just a completely seamless, integrated process.
All right, Section 3, built for the field, robust, reliable, and highly portable. Now, the crucial point here is how the hardware actually overcomes those specific field challenges we talked about earlier. The SureSight Mobile comes with a portable carry case that has a really small footprint, which is perfect for environments where bag space is just at an absolute premium. Plus, it features brightness controls and a tiltable screen. So whether you're in the back of a dim ambulance or out in glaring full sunlight, you can easily optimize the image. It's designed for serious durability across diverse environments and terrains. Oh, and here's one of my absolute favorite tactile features. When you attach the blade to the display, you get this distinct audible click. You don't have to guess if it's on right. That sound confirms correct and secure attachment every single time.
I really want to highlight this number for a second, 100. The device provides up to 100 minutes of continuous battery operation time per battery. That's a long time in an emergency, and these are exchangeable, rechargeable batteries. In the fast-paced context of emergency medicine, having that kind of juice minimizes your downtime risk significantly. You've got reliable power exactly when you need it most.
Moving right along to Section 4, the blade portfolio, comprehensive options for adult and pediatric patients. So the SureSight system utilizes a whole range of single-use, non-sterile blades that are suitable for both routine and difficult intubations. Basically, we have 2 main categories here. First up are your standard variants, which include those familiar Miller and McIntosh shapes, as well as a hyper-angulated option. But then you have the channeled variants. Now, the channeled hyper-angulated blades offer a very distinct, really powerful advantage. They actually allow you to preload an endotracheal tube directly into the blade prior to intubation, which just completely streamlines your workflow during a critical airway intervention. It's a real game changer. Also, notice the built-in integrated camera and LED light right there at the tip of every single blade in the portfolio. That proximity is key. It ensures you get a crystal clear view of the patient's upper airway. We're talking crisp, sharp images that make identifying critical anatomical landmarks so much easier.
It basically removes all the guesswork from the procedure.
And here is a seemingly small detail that has massive clinical implications. The camera lens on these blades is treated with anti-fog technology. I mean, we've all been there. There's literally nothing worse than getting into an airway and having your vision suddenly clouded by condensation, right? This built-in treatment helps guarantee that you maintain a consistent, unobstructed image throughout the entirety of the intubation.
Okay, final section. Section 5, tech specs and reliability. Medical-grade data and compatibility.
68 degrees. That is the precise forward-viewing field of view provided by the optical system on all the SureSight blades. And coupled with that, you have a depth of field ranging from 12 to 115 millimeters. To put that into perspective, this specific optical engineering is exactly what delivers that exceptional clinical visibility we were just talking about.
Now, let's look at the rigorous environmental specs. The unit is rated for an operating temperature between 10 and 40 degrees Celsius. So that's 50 to 104 degrees Fahrenheit. For storage, it safely sits between 10 and 25 degrees Celsius. Also, going back to those channeled blades we discussed earlier, just take a note of the endotracheal tube compatibility here. The 3C blade accepts ET tubes with an internal diameter of 6.0 to 8.0 millimeters, while the pediatric 2C blade takes 4.5 to 5.5 millimeter tubes. This makes sure you can seamlessly integrate the laryngoscope right in with your existing airway consumables.
We also definitely need to touch on the manufacturing standards. The materials used in these single-use blades are fully biocompatible, and they really give clinicians peace of mind because they are entirely free of polyvinyl chloride, or PVC. They're free of phthalates, and they are completely free of natural rubber latex, too. It's just high-grade material safety built right directly into the design.
Well, that brings us to the conclusion of this explainer. We've covered the ergonomic touchscreen, the robust field design, the comprehensive blade portfolio, and the hard technical specs. So I want to leave you with this final thought. With up to 100 minutes of power, advanced anti-fog imaging, and guaranteed clinical durability, is your current airway kit truly ready for the unpredictable realities of the field? Thank you so much for joining me today to explore the Ambu SureSight Mobile. Keep learning, stay focused, and I'll catch you in the next explainer.